Hello guys, welcome to the next episode of Project Hospital. We are going to continue our big challenge, which is we have to treat 60 people in expert mode, which is much more difficult than the normal mode because there are a lot of things we don't know. And also we have to be correct because if we are incorrect, we actually have some real trouble. Meaning, I think it restarts from 0. So, yeah. So let's just see. It takes a while. Sorry about that. Last time I think we only got to like one actual person. I don't think we're gonna finish it today. The only thing is that since we're gonna get money, obviously, in the process, we are still making money in the hospital. I'm gonna see if I can gradually, first of all, pay back some of the loans because we have a huge loan. We have 200,000 loan, which is a lot. Okay, we still make pretty good money every day, so I think it should be fine. But first of all, it's not going to be that much money because we had some events that added 10%. But that one can be answered by we are able to increase our number of patients very easily. But so far, I don't think that it's necessary. I'm still trying to have one when at the end of the day, this number is 0. I want every single patient treated and accounted for, like that's very important for me. All right, so let's see. Do we have some people who are waiting for us? No, there's nobody waiting for player here. Definitely not here. ICU, nobody in the ICU right now. I have to remember the ICU, the problem with the ICU, it only stabilizes. So that's what I learned last time. ICU only stabilizes you, which means that once you stabilize, you have to go somewhere. And if you don't have that place, you are in trouble. So John Allen is waiting for us. Okay, it looks like he probably has to go actually to traumatology, more or like that, but we don't know yet. And then let's see, orthopedia. Oh, two of them are already treated. That's very good. We have also one treated already here. That's good, but nobody's waiting for us. One treated here also. Nobody's waiting for us. That's good. We are actually having a pretty nice smooth operation. Look at that. Somebody's treated here as well. I'm actually really happy so far how it's going. I think we should be. I think it's pretty nice. Anyway, let's open this one just to make sure. Okay, guys, sorry about that. That was a nasty mosquito. Just thought that he's gonna fly directly towards me and thought that he's gonna survive it. Well, I'm sorry. I have a bad news for you. Anyway, we have that. Now let's actually take a look at our hospitalized patients here. We have a few. I don't know where they are. They are probably in different places being checked out. For example, this person, I guess, yes, Judy Robinson, is getting right now that looks like she's getting an ECG, isn't it? Not a microbial sampling for sure. I think she is getting an ECG or just done. It says microbial sampling, but the microbial sampling would be just in the lab, so I don't know. And she's definitely not in the, toilet or whatever, so I don't know why. I believe that's the cardiology, isn't it? Let's see. Yeah, that's the cardiography unit. That's right. That's right. So she's getting an ECG. Apparently, we already know that the ECG shows nothing. Okay, I can live with that. Anyway, so that's Judy. We have 3 people in the hospital. This guy been here for the last day already. He is getting urine analysis testing and ECG as well. Look at that. All of a sudden he has a lot of options because we are in doctor mode, but that's fine. look at all that he does. 1, 2, 3, 4 pages full, and he is still a big question mark. So we still have to figure out what's wrong with him. It's gonna be tough, but right now he is still going to the ECG in a minute, so we just leave him alone there. Let's not clog our work up. Where is the third person? There was a third person here. Only 2 here. Are you serious? Did we release somebody or he went up to the 3rd floor? Wait a minute. How many people? Oh, yeah. Only 2, only 2. Yeah. Because Thomas Wright, we ended up, with our little cheating here, we ended up actually treating him like that. I mean, he might end up going back there, I don't know, but for now, he is not. So I think it's good. All right. Okay. So, oh, shoot. We have all these people now. Get rid of that. Get rid. John Allen is the one waiting for us. And let's get rid of all the others for now. We don't need them. And let's continue what we are doing. Okay? So, John Allen, what do you have? Chemical burn on arm, chemical burn on torso, poison ivy crash. Well, we're definitely going to do a physical first. And you know what? Let's just stop it there. Temperature, do we need? Let's actually just stop it there, right there. Because once we see that, we should be able to decide these two or this one. Okay? So once it's decided, then we can continue from there. That's our patient, and let's go. It's 10:47 right now in the morning. It's gonna take a while, unfortunately. All right, let's go to Dana Anderson. Okay, at least we know exactly what he has. He still has an unknown number of hidden symptoms. So sore throat, pain in the ear, fatigue. I would definitely do a physical. One of, some of these are going to be physical things. Apparently, we need to have an oral inspection. I mean, we should, yeah. Sore throat, you have to have an oral inspection. Let's check her temperature. Pain in the ears, we have to do an ear exam. Okay, let's do that first. And then let's see what we are still missing, okay? All right. Oh, hold on, though. Hold on. Wait. Oh, yeah, that's an emergency problem. Okay, no worries. So, Michael Foster, what do you have for us? First of all, this one should go somewhere here, like this. Okay, again, he just have a blurred vision. All right, we're gonna do a physical. Let's do a neurological. Let's see if he has photophobia or stuff. And we don't need a visual test because we already have that. Which one is the best to do first? Because now we have so many different things. I kind of have to make sure that it's something that actually makes sense. Physical, neurological. Let's do a speech listening. Okay? Okay. Frank Lopez. You see, every time we only go further for like 1 minute or something, and we have a patient, because we have a total of 77 patients. We have right now 43 people in the hospital, 4 of them are in bed, 39 just around, but we're gonna have a lot more coming in, obviously, during the day. So, what do you have, Frank Lopez? Oh, you basically had a full plethora of things that you had a problem with. Let's see if it's our... No, it's not our customer. That's okay. We only have one treated in specialist mode. That's the only problem. Like, I can only handle 6 doctors. I could technically let all the rest of the doctors like roam around, just do whatever they want. But I don't want to because first of all, they would clog up the hospital beds so quickly. And second of all, I just like to control the whole thing. So what do we have? She's farting, he, farting, vomiting, have abdominal cramps, diarrhea, everything. So we know that he's lactose intolerance. We definitely don't do an abdominal palpation for sure. I'm not even sure if I need a physical. Apparently, I don't even need that. Okay, abdominal palpation would give him a diet modification, but actually he gets that from lactose from that itself. So I'm thinking, since we have so many people, and this is not even my doctor, so I cannot be really wrong here, I think I'm just gonna treat him, sorry. Another 2 minutes passed. Let's go to Thomas Martinez. Patricia Smith is not my doctor again. We have a ton of doctors. So it's a bigger chance that I catch none of my doctors than mine. Okay, so Thomas Martinez. Okay, this is what... Oh no, this is not what happened. This is... Oh, come on. Every time I say a certain word and I don't want to say it right now, my chat monitor goes off the chart. He just goes and becomes Google and stuff like that. I don't want to do that. Okay, so we still don't know. Okay, we got rid of one of the internal medicine problems that we were possibly having, I think. So I think we narrowed it down by one, if I remember well. I'm not sure. But as you can see, we already did 2 page worth of things. We already did ophthalmoscopy and all other stuff, gonioscopy, and we still haven't figured out what's wrong with him. Let's do species and what help us? I don't think so. I didn't see anything like that. So look at this, all this, and I cannot just simply say, oh, these are the available ones. Everything is available right now. We already checked his temperature. How about, since we are in neurology, if we do tonometry 1 and 2 would show something, some others wouldn't. And gonioscopy we already did, right? Yes, because that we could do in the office. That's why I decided I do that. I think maybe we should get a microbial just to make sure. We did an optomoscopy and that didn't show anything. So I'm pretty convinced that this is not the problem here. But then again, you never know. So yeah, I'm thinking of just do a tonometry. Now, if I were to do a tonometry, does it need perimetry? No need. He doesn't have. Perimetry would be like 4 little arrows showing everywhere. So we don't need that. It's only 10:50, so I don't send him yet to microbial, but if it's necessary, we will do that. For now, let's just do a tonometry and hopefully it's going to help. Go to here. We have, oh, okay, Meniere's disease. We know what your problem is. We did a physical, and that probably showed us nausea, I guess. I would think so. Paul Martin is not our doctor. That's so annoying. Okay. But I mean, yeah, I could just let them doctors do it, but I don't want. So let's do an abdominal palpation. Oh no, hold on. Anxiety, audiometry, and ear exam. Yeah, because if you are unstable, whatever, actually, it can, from your ears, it can have a problem. Yeah, from your ear, because if your ears, basically, your balance is controlled in your ears. So yeah, that makes sense. Just have to find it because there are so many of them. I don't want to miss it. Where is it? Ear exam, there you go. Audiometry I could do as well, but what would it do? Actually, it would just give you recommendations if you do this. Eardrops here. You know what? Audiometry is more important than ear exam, okay? So let's actually do the audiometry and not the ear exams. Because we're already getting the recommendations, so no need for that. Stomatics, we're already getting from there. Physical. Yeah, I think let's just do an audiometry. I'm not sure about this one. Like, it would give, yeah, it's a low, so I think it's fine. Some of the mechanics of the game I'm still not sure about, so it could be doing something that is, not the right way, and I learned it slowly, um, mostly by mistakes. So let's see, we have headache, fever, and fatigue, and this is not my doctor either. Let's see what we have. We already did interview, physical, speech, and temperature. So he doesn't have an extra high temperature. I would actually give a blood pressure. And it's probably somewhere here. Like this one here, right? No, that's an ECG. Okay, you know what? Chest auscultation could show something. Let's do a... I want to do a blood pressure measurement. I think it's useful. Neck palpation. Neurological, maybe? It really suggests what is it? We could actually do a thorax percussion because that happens again, like a lot of different things show that, so we can actually narrow things down. So let's do the chest, blood, and thorax. We can do it all right here. You know what? Let's even do a basic physical. Oh no, we don't need that. It doesn't seem that anything would have a blurred vision or anything, which is actually interesting because if you have a fatigue, it could come into question as far as I'm concerned, but maybe I'm wrong. All right, let's go. Kidney stones. Okay, that is a general surgery issue. How many people are in general surgery? 4 people. One of them is hospitalized. Yeah, Frank Anderson. So 3 people practically. And we have 3 doctors. You know what? That's fine. You just go to general surgery. The only problem is I don't think you can get... Let's see. Maybe it needs hospitalization. I don't know. Let's see what can we do over there for you. Since you're already there, we're definitely gonna have a physical check. Abdominal. Okay. Urine test would give you antibiotics, but oh, you know what? Maybe it's a good idea. Let's do a urine test because you have painful urination and urine urgency, whatever. You have all these, so I think you should have a urine test for sure. Here. And what else? And the temperature. Okay, you're gonna be busy for a while. I'm sorry. But welcome to our hospital. Enjoy your stay. Oh, Lisa Moore apparently is having a cardiomegaly. What is that? An abdominal enlargement of the heart. Now, okay, he has to go over to the cardiology department and quickly get some diuretics and bronchodilators, or how do you say that? And once they are done, let's actually do some physical and some other stuff. Okay? Let's do some physical, some abdominal palpation, and then echo and ECG, basically. Both of them can be very... the ECG is more urgent, actually. So let's schedule for her an ECG. We already know what her problem is, so we can actually... Whatever we need to do, we can schedule it right now. You do an ECG, you do an echo. Basically, while we are trying to decide what the sickness is, I tend to give... I try to avoid a lot of extra inspections, because like I send somebody to ECG and echo and everything, and it has nothing to do with him. Then I just wasted a lot of time, wasted his time, wasted my time, wasted a lot of resources. But when I already know what her problem is in this case, and we know that irregular heartbeat could kill her, obviously we're gonna do it. Okay, so what else? We don't need that. Physical, we of course do that, as I said. Physical. Yeah, let's do a CRP as well, because then we would give him some NSAIDs. So let's make sure that she gets everything what necessary. I just hope that they give her these first before anything else. Otherwise, if she collapses, it can be annoying. CRP, there you go. Because we don't have a cardiology, if she collapses, it could go to the ICU. That could be a problem because we don't have a cardiology hospitalization. So, okay, let's do that. John Jackson, cool. Viral tonsillitis. Okay, we know exactly what your problem is. We still have some hidden symptoms. Again, I'm pretty sure we're gonna do some physical. Shouldn't we? I'm not even sure we need any physical. Yeah, let's do some physical. Let's do some chest auscultation. Let's do a temperature check. Let's do an oral cavity check. Neck palpation. All right, I think that's... Oh no, we still have to have a nasal cavity. Nasal cavity, should we do that? These are all low, I don't really care about them. Sunny. Nasal cavity, I'm not sure. I think I ignore that for now. Okay. Michael Smith, let's do, and we still only have one in specialist mode. I didn't really check every time who is the doctor and whatever, but yeah. Mania disease, okay, so we did the audiometry, and look at that. It turned out from audiometry that he does have hearing. No, it was there. No, I think the hearing problem is the new. Anyway, so we already have that. No need for ear exam. We already did the physical. So let's just treat her. Him, sorry. I always mix up him and her, guys. So if you hear me doing that, don't get all jumpy about it. It just happens, okay? Sorry about that. Okay, Jane Gonzalez. Okay, you are in traumatology and you have redness and breathing problems, which sucks. I understand. However, look at that. You are in here, but it could be that you have some other part. It's not necessary that it's all traumatology related. Anyway, definitely going to do a physical exam and the chest auscultation. And what else do we need? If you are indeed here for the right reason, anything that could be like really dangerous for you. Let's see. I'm basically looking for anything that possibly leading to collapsing and try to pick them up first. Evaluation, blurred vision, not really. Blood pressure, hypertension is actually not a big possibility here or not a big deal here. I don't know how it works. Okay, let's do a speech listening as well. And definitely let's check the temperature. Okay. There you go. John Allen, you back. And physical showed, I believe, some swelling here, but it didn't really clear up the thing. Let's actually check your temperature, sir. Okay. And evaluation. Yeah, I think an evaluation would be just perfect. Maybe it's gonna actually figure out everything. Okay, evaluation may be just the key here. Let's see. Okay, Charles Hill. So finally we got at the 11 hour, which means that we finally have an extra autosave. That's why we have to remember to make sure that save it when we are finishing, because otherwise, if for example I do 45 minutes worth of work here, it could be, I might spend an hour on that because it's literally 1 minute, jumping 1 minute from different patients, sometimes not even that much. So it's possible sometimes that I spend more than an hour in a hospital hour. So that can be a problem. Okay, so he doesn't have fever. He was just here earlier, right? He doesn't have any fever. That's good. Lactose intolerance is actually emergency, so you are in the right place. What else can you have? Nothing really. So let's just treat you. Oh, hold on. Sarah Martin, is Sarah Martin ours? No. So yeah, you just treat it like that. If it's our doctor, we have to make sure that we are treating him ourselves. But Sarah Martin can handle him just good. Oh, hold on, not good enough. We have to give him some spasmolytics. Okay. Let's go to this guy. Daniel Jones is. Oh, this is our. Okay, this is our patients. Finally. You have headache, fatigue, and fever. Okay. Without looking at anything, because there are so many things, I would definitely give you a physical. I would check how high your fever is. And I would do a chest auscultation and I would do a speech listening. Let's start with that. Bacterial tonsillitis, tularemia, or viral tonsillitis. Okay. Fever, painful lymph nodes, and sore throat. Okay. We're definitely gonna have a physical. Let's do an ear exam. Because two of the different basically emergency department issues would have that. Let's do a chest auscultation. Because this one would have a sputum cough, this one would have a dry cough, this one would have a dry cough. So if we have a dry cough, then it's one of these. If you have a sputum cough, there you go. So actually, I'm not even giving her more. Let's try to figure out which one first. Okay, William Miller. You have a hand pain. Okay, hand pain, and this is my doctor again. Good. And I'm beating alive by mosquitoes again. Hand pain, let's do a physical for sure. And yeah, let's just start with physical, nothing else. Because that should give us a ton of information first. I mean, he has hand pain, but he asked him to take off his shirt, but that's okay. Maybe he's handsome. Let's go. Okay, you have a definitely neurology already. We know that. So you are in the right place. That's a good thing. Eye pain and blurred vision. Neurological and speech thing didn't help us anything. Okay. Physical didn't help us anything either. Let's try with Jonioscopy. What is it? I'm pretty sure that some of these, yeah, Jonioscopy is here for sure. Basically checking your drainage system. We should have an optomoscopy, right? Like that's a basic, and the Jonioscopy. Okay, let's do that. Okay, we know that you have poison ivy rash. Awesome. And we have everything done. Now, Jennifer Harris is not our doctor, so since you have everything, let you just handle it yourself. Do we need an antihistamines? Let's see. Itching is just low, no worries. Everything. This one would have. Alright, we don't need any of them. Everything is low, so good. We're gonna have another, we already have 10 patients fully treated. We are getting some money and everything, so we are doing well. Okay, William Miller, Dana Harris just did a physical on you just now, and it turns out you have Rhino symptom. Okay, and we have everything here, what we can, we have all the possible symptoms. There is no extra symptom, which is funny, like it says that still have a hidden symptoms question mark. If I really wanted to make it hard, I would put that still on, even if it's all done, because right now I don't even look at anything here. I mean, I can, and it's physical, we already done that fine, but if it's more, I don't even look at it because I know that he has every, he's done, he's done. So let's just do this, and again, I'm not just gonna leave him that. I'm gonna give him basically the vasodilators, and he's gonna get some analgesics, and you're done. And I'm gonna release him when it's done, personally. Okay, headache, fever, fatigue, and thorax percussion, blood pressure did absolutely nothing. Okay, okay. I think let's send him to ECG because I don't want him to like collapse on us. Okay, let's send him on an ECG. And at the same time, why don't we do some long-term ones? Actually, PCR testing is a lot of places it suggests. I saw more than one PCR. Serologic testing, X-ray, serologic testing. No, ECG is fine. That makes sense. Fatigue, headache. Let's see. Basic visual test. I don't think that we. No, I cannot go by these because this is like everything. I still have to follow this one. Let's see. CRP levels. Are the CRP levels high? In other words, is it some kind of inflammation? I think that's a useful thing to do. All right. ECG, CRP. Neck palpation seems to be something. No, that's oral cavity. Sorry. Looked like neck palpation, but I think it's oral cavity. Actually, speech listening is a... Oh, we already did that. A lot of them actually have chest pain. So let's do a thorax. Oh, we did that. Hmm. Actually, did we check her temperature? Yes, we did check his temperature as well. I hate this part when there's so many different things that you kind of just try to figure out which ones are the ones that like so many different ones might have. A PCR testing here as well. Serologic testing could actually bring out a lot of things, possibly. I'm not gonna do an MRI and stuff like that yet. A lot of people, they are suggesting a lot of serologic testing. Excuse me. Fatigue, headache. Like it's one thing that I know that I could do all of these, but the question is which one I should do first, Which one is the logical thing that we would do? PCR sampling, a lot of them saying, but that's a medium. It's not a comfortable thing to do. And I try not to do something that is hurting the people until we really know. Well, serologic test sampling is not a comfortable thing either, actually. You know what? Let's do these two. Maybe it's gonna reduce the possibilities a little bit. And then we go. So Robert Foster, hang on, please. Kidney stones. Okay, we know for sure that you have kidney stones, and you are in the right department for that. That's good. What do we have? Abdominal palpation would give you analgesics, which you already have. Rehydration and antibiotics. You're not getting any of that. Okay, you know what? Let's do that. Let's do a urine test, a temperature test, a urine test. Physical, we already, of course, did, right? Hey, we haven't done a physical? Come on. Obviously, we start with a physical, right? Alright, let's just do these three. Physical, temperature, and urine. Okay. Sarah Harris. Oh gosh, you have... Alright, what happens if it's an infectious? It would have high fever, still just fever. No, high fever, high. So he would have high fever unless this one. So let's do a fever check. Temperature test. I mean, we're definitely going to do a physical, obviously. And what else is common here? You know what? Let's start with just that right now. Physical and temperature measurement. Photophobia is actually something that he's afraid of the light, inability to tolerate light. So I'm thinking we might want to do just a basic visual test as well. There you go. ACL injury. Okay. And we already know that for sure. So Rachel Hall is obviously not here. You just please treat him as it is. We don't need an MRI. Again, I always help him out a little bit because he has like he does need the NSAIDs. Recommendations? I don't think so. And ice rep we don't need it because we already do a RICE. This is basically what is it? A RICE is rest, ice, compression, and elevation. So we actually do the whole, we go to the whole 9 yards. So we're just gonna give him also some NSAIDs so he's not having some walking problems, that's all. Let's go to Jane Gonzalez. He has a low voltage burn. Okay, what else do you have? We already checked your temperature. We already did interview of what we did. Blood test, nothing. Okay, we're just gonna treat you. Thank you so much. And we are giving her everything, so we don't even need to double check that. All right, Dan Anderson. Okay, you did the ear exam, and it didn't show anything. Actually, the funny thing is, but the temperature and oral and some others that we did, so it was a good one. It's not our doctor again. That's annoying. What else do you have? Physical, we of course did. Chest auscultation would give you cough suppressants. So let's do that. Let's see if you're coughing. Neck palpation would give you analgesics. You already have them. I don't give you. Nasal drops would be a new thing if you need it. So let's do a nasal cavity inspection. Laryngoscopy, I don't want to give you that. And serologic testing would just give you rest, which actually this one is giving you already. So let's do nasal and the chest, and we can just treat you after that. By the way, we already have 12 people, perfectly done. 4 people in the 4 people in the bed, 39 people in the hospital in general, and we have 12 people fully treated. It's already 11:25. You know, time is kind of running, but whatever. You know, we have a lot of untreated customers, unfortunately, all the time. So one of my main goals is just to make sure that nobody's left behind. I did that in a video. I gave that title, and then we ended up with like 5 people who had to go home, which is really annoying, you know. That's sad. Anyway, you already taken care of. Let's go to Michael Foster. Okay, you are in the neurology department, so that's fine. We have a lot of things already, and it didn't really help you, right? Okay, what else can we do? Chest auscultation wouldn't help you at all. Let's see. It's better to go from here, from physical. Perimetry and tonometry is probably gonioscopy. Did we do it? We did the gonioscopy and optomoscopy. Okay, so that's done in the office. What else we can do in the office? I don't think we have anything else we can do in the office. Maybe some, what is it? Some, I call it itching test. What is it? But I don't think that we can. Physical, it's mostly physical, and it didn't really show up. Neurological, we already did that. Yes, we did that. Physical, we could do microbial if we wanted, but we don't know it's. I don't want to spend that much time if possible. I think tonometry and perimetry is quicker than that. We might have to still do it. You see, everything is just physical, and other than that, tonometry, perimetry. Oh, gonioscopy here. We already did that, and it didn't show up anything. Tough luck. Yeah, let's just do first the couple of these two things, which is perimetry and tonometry. So tonometry is for measuring the pressure in your eyes, and the perimetry is measuring the field of vision. I don't know why that's really important, but apparently it is. Well, if it's for now, it is important so that we can actually decide what is your problem. Once we know what the problem is, sometimes we can, just forget about it because it's not really we cannot even treat it or whatever. But for diagnosis purposes, it could be important. So just do that, which means that you have to go out to the neuro exam office, which is right in the corner somewhere. Here, this is the neuro exam unit. Who is this? She is being tested right here. And look at that, she is actually pretty much ready to go home. We'll see. She is still being examined, so let's finish it. Okay, we have this, but this is a cardiology issue. Let's see how many people are in different departments right now. We have a ton of people here, and cardiology almost nothing. So that's a no-brainer. Please get out of my sight, even though it's Lisa Hall, which I believe one of my... Oh, he's not even my doctor. That's not... Hold on, we had a cardiology. Daniel Jones. Okay, so let's send you over to cardiology, and I'm gonna tell Daniel Jones to take care of you. That's a good one. And what do we have? Let's do a physical first. Just gonna take care of all these. I don't even know if it helps though. Yeah, you already got the analgesics. Nothing. Ice wrap. Do we need an ice wrap? Uh, yeah, I mean, maybe. If you need an ice wrap, fine, get it. Other than that, it's really useless. But anyway, you have to go over so that, first of all, Daniel Jones has a chance to treat somebody. Second of all, you are in the right department. Nice. Thomas Martinez. Oh, we still have this pesky possibility of internal medicine, but that's all right. We did the gonioscopy and tonometry. Wait, we didn't do perimetry? Oh, we didn't need perimetry. Okay, so we still don't know anything. Okay, I think we have no choice now, and it's already getting late. We did pretty much everything else, guys. We really did everything else. And geography we haven't. Gonioscopy we did. So I think the only two things we can do is an angiography and a microbial test. The rest, we covered it. Yeah, let's do a microbial and an angiography. Let's actually do an angiography first. We still have time. I'm looking for angiography. Come on. Just one by one, please. Angiography. Where is it? So many of them. Here. Okay, and we do the other one later, because if angiography gives us the exact answer, we don't have to do that. So I always try to reduce redundant stuffs. Okay, so you have bacterial tonsillitis. Basically, it's just an infection. I mean, yeah. What do you still need? You already had interview. Okay. Yet physical ear and chest, no problem. Oral cavity would give you NSAIDs, which we kind of need. Nasal cavity would give you nasal drops, which is possibly we need. This one is medium, so we have to do it. Nasal congestion, this one, I don't really have to do it, but let's do it. Okay, so let's do oral and nasal cavity. And this is our doctor, so finally we're gonna have another one actually done. That's good to know. Okay, so basically you are vasculitis, patient is waiting for a plan of treatment or send him home. Everything is taken care of. So you just please go home and thank you. And we just got our second actual finished guy. Daniel Cole did a speech listening, didn't really do anything. But for whatever reason, it still helped either giant cell arteritis or lupus. Now, this one would be an angiography, I think. No, yes, angiography would figure it out. Okay, if you do an angiography, it would clear it up. CRP wouldn't help us, okay, because both would be elevated CRP. That's useless. Optomoscopy could show this one as well. Sudden complete or partial blindness. I don't think that you can do that there, right? Luckily, it looks, I mean, I don't know if it's lupus, which is funny because, I've just watched, what is it, Dr. House. And, in some American series, like, this kind of medical series, maybe lupus is one of like a meme, it's like a meme. So let's actually do what is easier to do, which is quicker. Ophthalmoscopy, actually, I can do it right here in the office. So let me do an ophthalmoscopy first. I'm not sure if I can do it in this office. Hold on. Maybe I cannot do it in this office. It would be really annoying. That's excuse me. There's a very big possibility I cannot. Yeah, I cannot do ophthalmoscopy. Oh, dang. Can we do... Chest auscultation we did. Let's do a thorax percussion. But I don't think it's going to help, because if he doesn't have something, it's not going to mean that he doesn't have this sickness. And geography, on the other hand, would really turn it out, find it out very quickly. So let's do that anyway. That's okay. But I'm going to do an angiography, and that's it. Okay? If you find it. Angiography. Here you go. Let's do that. And that's going to put an end to it. Thorax percussion. You see, didn't show anything. That's fine. So he's gonna go. He already finished that. You see. Um, so that's fine. And let's just go. He's gonna do an angiography, and then we will know exactly what's wrong. Okay, viral tonsillitis. We already did oral cavity, and look at that. We do need the NSAIDs, and we did an. Did we do a nasal cavity? We haven't. Why didn't? Why didn't we? That's kind of weird. Why I didn't do nasal cavity? Do a nasal cavity, please. I kind of missed it. Sorry about that. Okay, so he's getting that, and at the same time, Kate Davies discovered something. Ocular hypertension, which he needs some eye drops for, but we already know that he has conjunctivis bacterial, right? He's actually getting all the different treatment for it. Let me see if we need any more treatment here. Low, it's a medium, so let's give him some eye drops. And once we've done that, we're gonna send her home. Okay. Nancy Martinez, what do you have? Abdominal pain and weight loss. And we already had a ton of different things on you. And it's useless. All right. Jordan Young, you are not... Oh, you are my patient, actually. So I have to really pay attention to you. By the way, how long have we been on, guys? Getting to roughly an hour, right? I'm not sure. Anyway, what can we do with you? After all these species of CBC, so we did all the CBC, CRP, nothing shows up. Okay, I think we do need some microbial. Let's do it just simply. Oh, hold on. Let's do an ECG if we haven't. Okay, I'm gonna do an ECG on you just to make sure. But let's do a microbial gastroscopy. I don't want to do this kind of horrible things on you. MRI, blood test. Physical interview, stool analysis, abdominal pain and weight loss. It could be that. It could be, unfortunately, could be even cancer, but it doesn't show that. Okay. Physical, what else can we do that is like normal? CBC testing, we did that. A PCR testing. And if it's positive, it could be something very dangerous. CRP we did, right? We did a CRP testing. Yes, we did. In general, I think a blood test could be okay. Maybe this one is... This person might end up in our hospital. And don't forget, we already have a general surgery hospital area, so we can actually send him to the hospital if we want. Let's see, how many people are in general surgery right now? Do we have a lot of patients? Actually, we have quite a few. So why, I mean, not a lot, but it's still a lot of trouble. So why don't you actually send you? I don't dare to, because if he has a cardiology issue, then we would have a big problem. Okay? So let's make sure first that he doesn't have a cardiology issue. Makes sense, right? We did infectious disease I should be worried about, but it's not, because it's definitely not. We cannot have that. Simply because we don't have a infectious disease department, and in that case, it's not going to give us infectious disease patients, which is stupid, but it is what it is. So, but actually at the same time, if I send you to ECG, no, I don't want to send you to ECG. Let's actually do a blood test. Did you do a blood test, CBC? No, we haven't. Okay. So let's do a normal blood test. Let's find it, because there are so many things here. Did I miss it? One more time. Or it does, it actually shows pretty much everything that is available, so it wouldn't be hiding it. Blood draw, there you go. What is that? No, it's post-surgery, whatever. We don't need that for sure. Let's do a blood test, and let's do a microbiome sampling. Gastroscopy, we don't want to do that. That's really only when we need it. Abdominal, we did, right? Did we do an abdominal? Yes, we did. Okay, so that's not what we want. Yeah, let's do a blood test. And you know what? Should we do a crap test as well? No, I don't think so. Not now. Ah, you know what? Why not? She has to wait for the blood test to come out. Why don't we do also a crap test? Stool collecting. All right. But as I said, this person might end up in our hospital. And I'm thinking maybe I should do that because I'm clogging up the other people's work, the other people's time. So I might do that. Where is it? Actually, you know what? Let's send her there. Sorry. Actually, we're gonna do you regular hospitalization. Okay? All right. Now let's Fraser Rodriguez. What do you have? We already know that you have otitis externa, which is not this department, sir. And nobody is in the internal department. So go internal medicine. So go over there and do something. Let's see, what do we need? We're gonna need a physical because we might have some edema. Um, let's do ear exams. We already get the antibiotics. And let's check your temperature. So let's do an ear exam. And let's see your temperature. Okay, but you go over to the other department so you're not clogging us up here. Okay, you're hospitalized and you're still waiting for an exam room. Oh, we finished the urine testing and came up with squat. Nothing absolutely. Okay, then you keep waiting, my friend. No worries. Okay, Karen Hernandez is not our doctor, unfortunately, but that's okay. I think we pretty much covered you already, but let's double check. Physical, we did. Neck palpation, we haven't, and it would give you analgesics, but you're already getting them. Nasal cavity, we did that, and you don't need nasal drops as far as I can see. Yeah, you don't. We don't need that. Alright, so let's just treat you, please. Let's see, coughing is not a high one, and NSAIDs definitely. So let's give you the NSAIDs, what you need, and let's go to the next person here. Okay, finally, I think. This was the one that has all different kind of things, plus one internal medicine one. And that was really, really, really annoying. So now we can send you over to neurology. Let's see, the neurology department has actually a few people, 4 people right now. The good thing again with neurology department, if necessary, we can send you to hospital at the end of the day and wait until tomorrow. So let's just go over to neurology. Now let's see, do we have a neurology doctor on here? Yes, Nancy Cole. So please go to Nancy Cole. She's gonna take care of you. Yeah, okay. So Nancy Cole, please take care of her. What you need to do, we still have to figure out what's wrong with him though. Or her, sorry. We can do it this time, we can do a Jonioscopy because that's in the office. And an ophthalmoscopy. Okay? I think, I'm not sure if it was actually one of them, probably. Basic visual test, we've done it. Okay. I'm not sure if ophthalmoscopy was one of the possibilities. Yeah, it is. So let's do that. Junioscopy and ophthalmoscopy, both of them are in the office. We don't have to go anywhere. If it's not enough, we can do some tonometry. And of course, microbial if really necessary. Okay, so Sarah Harris, you're taken care of. Go. Jessica Foster, kidney stones or urinary tract infection, both of them are general surgery, so please go over to general surgery. Who is in general surgery for us? Jordan Young. Okay, Jordan Young is going to be bloody busy. I apologize for that. Actually, let's take a look at Jordan Young. Gonna take a look at it in a minute, how many patients he has. Now, since you're already going over, regardless what happens, we have to check your fever. Okay, so it's not to diagnose, it's to just to, you know, it's really just to see if you have fever, because either way we have to treat it. Interview, urine analysis. These are both very low things. Physical, we already did. We haven't. Are you telling me we haven't done a physical exam? So let's do that. Physical and temperature, that's fine. Let's also do an abdominal. And that hopefully just gonna tell us that this is the one, because this one is more money. So I kind of hope that is that, but sorry for that. Okay, you did a temperature test and looky ducky, look at there. He does have a fever. He doesn't need diuretics, and let's see, he's already getting the eardrops and already getting the antibiotics. So Thomas Lee, you're not my guy, but anyway, just treat him, I mean her. But let's see what he's gonna get. He is not getting the antihistamines because itching is low. Recommendation, yeah, no need. Okay, it's low as well, so that's fine. We can leave him alone. And Mary Garcia has an ankle injury. Sorry to hear that. It's mostly orthopedic, possibly emergency. Now, the easiest way and quickest way, James Gonzalez, you only have 1%. I don't like it. So, sorry, you gotta go over to Elizabeth Hernandez, and it becomes actually our patient this way. You're gonna do a physical and what is it? Differential. There you go. Physical and differentials should actually find out what exactly your problem is, and then we don't need any of the rest. Okay? Now, if it's already decided which one, that's okay. If it's decided, but at least we know it's not decided, but we know that it's orthopedic, that's okay too. Okay, that could be annoying, but because then maybe it's not going to be my uh, patients again, but that's okay. Irregular heartbeat, look at that. Frank Young, we sent him to an ECG, and that was very good. So it turns out that he is supposed to be in cardiology, that's good. Irregular heartbeat, we're going to give him the beta blockers right away. And since he's already here, let's give him the cough suppressions and the antibiotics as well, while we are looking for something else. Angiography, we don't need that because he's already getting those anyway. Let's do a blood pressure if we haven't. Oh, we already did a blood pressure. We did a blood pressure and it actually came up with, oh no, we haven't done it. Okay. So he is still actually working on some other stuff. Now, do we even need thorax? Yeah, we do need the thorax. It would give him analgesics. Speech listening, okay. Let's just keep going. Hopefully, his irregular heartbeat is going to be treated. But we definitely don't need the angiography because we already know what's going on with him. We haven't done it yet, right? Okay, so okay, and should be... Oh, he was tested here. He has to go to the office to get these treatments. All right, no worries. Thorax percussion. Okay, we know that you have asthma, but if you have asthma, do we need to make sure? Yeah, we have to have a spirometry. No, that would give you just the bronchodilators. That's okay. Let's do a speech listening. Oh, speech listening we did already. No worries. Thorax percussion we did already. So everything is done. We just have to treat you, and obviously we're gonna have to give you the bronchodilators. The rest up to you. There you go. So what else? Hey, sleeping drugs. Cough suppress, no need. Sleeping problems, no need. Okay, so he really only need the bronchodilators. One he's done, he's gonna just go home. Hold on, Paul Martin is not our doctor, right? So yeah, no worries. I kind of like have this reflex to release it, but sometimes I think I know that I cannot, because if it's my doctor, I believe, I'm not even sure, but I believe I cannot let just go. Elizabeth White is, so you are my patient, so you're gonna be treated and fixed in a second, sir. We already did the chest auscultation, didn't we? Yeah, we did. And we did, no, we didn't do that, and we don't plan to do this. You know what? I'm not sure if we need to. Because that's a very uncomfortable thing, I believe. Laryngoscopy is a medium discomfort thing. He's kind of happy right now. Discomfort is already quite bad, you know? So, do we need to do that? It's a very low things. I think we don't need to. We already know the exact thing. It's a low level something. I think let's just treat him right now. He is not coughing, right? Okay, so let's do that. Fever, let's do first of all, obviously we're gonna give him the main treatment. Fever, we're gonna give him the antirheptics for sure. This one goes the NSAIDs. Low muscle pain, just rest. We already have that. NSAIDs, we have that. Analgesics, pain medicine, you get it. Also, nothing and nothing. Go ahead, sir. You're basically done. We just have to wait until everything is done and we're gonna get a go home sign. So that's good. Inclusion, body myositis and polymyositis. Okay, so we already know for sure that Frank Allen, you are actually supposed to be at orthopedia. So what on earth are you clogging up our little emergency department here? Look at that. Emergency department is still so many people. And orthopedia has one. Come on, be reasonable, sir, and go over to orthopedia, where of course we're gonna be very happy to treat you. Orthopedia, no, we don't have any orthopedic doctor here. We should have actually have like, maybe I should have done it in a way that in every department I have at least one doctor, but too late already, never mind. So what do you have? What's the difference? It must have been finger flexor knee extensor muscles, and this one is goes to the body trunk. Okay, so it's a different place basically. So physical should actually probably just figure it out which one. But anyway, you go over there, do a physical, and we take it from there. Okay, guys, I think I have to more or less finish it here. We are almost at noon here. So before anything, I will have to make sure I save here. Because if I don't save, I'm in trouble. You see, there is only one autosave that was like almost an hour game time before, and that was a long time ago. Remember, I showed you, oh, from now on, and I haven't even finished 1 hour since then. So let's only two so far. We only have two people actually out of the 60 goals, so maybe we kind of messed up who we are controlling. But anyway, let's just save it here. And thank you so much for coming, guys. I think we already have $10,000. That's not bad. We are already getting some cash coming in, which is always good. But we still have a lot of loans, so we have to take care of that. We have 42 people in the hospital, 38 and 4. I would like to have a full 77 people treated today, or whatever the number is. I don't want any untreated people. That's my second goal. But as I said, it's going to go in uh, multiple streams and multiple phases. So thank you for sticking with us here, and hope you enjoy it. If you want, you also check out some other streams that I'm doing for Ostriv, the medieval village. And if you want to see something particular, put it below in the comments. Um, I'm not promising that I'm gonna be able to do that, but I'm always looking for ideas. So do that, please. Don't forget to hit the like button if you liked it, subscribe button, bell, all the other stuff. You could actually follow me also on Twitch if you wanted. And I'm gonna see you guys next week. Next week, sorry, next time. Thank you and bye bye.